Okay, good afternoon, everybody, and welcome to this webinar on the Multichannel Rep. My name is Annelien van Boxlaar. I am VP at Across Health, and I'm co-hosting this webinar.
Yeah, sorry, I think Annelien has dropped off the line. So I'm taking over. My name is Patrick Vidal. I'm a Managing Director for Across in France.
Okay, Patrick, I am back.
Yes,
I'm
okay,
back. Apparently something went wrong. So Patrick is the Managing Director of Across Health in France, indeed, and I'm Annelien van Boxlaar, a VP of Across Health. This is the third Across Health webinar on the Multichannel Rep. But the topic still remains a hot topic, as there is a growing expectation that the field force is truly acting as the orchestrator of multi-channels. And that requires new skills, but also new tools and even new ways of working. So today, Patrick and myself will give you a glimpse of the advancement in this field. Now, before that, before we dive in the meat, some practicalities. The webinar will take around 40 minutes, and we will follow that by questions. You can submit your questions through the tabs that you have at the bottom. The first one is ask a question. We will answer all those questions at the end of the session. There is also a vote button. This one you will need when we activate the vote during the presentation. And finally, we would also appreciate if you can rate us through the rate us button. The webinar will be recorded and will be made available immediately after the session on both the BrightTalk platform and dedicated website of Across Health. What will we cover today? We'll start with the basics of the multi-channel rep. Where is Pharma today? What is the multi-channel rep doing currently? And the next two parts of this presentation are on improving the current status. On the one hand, by improving the customer experience based on insights of what physicians really want. And on the other hand, on a better integration between sales and marketing. And that's in order to equip the reps better with the right info and on the different interactions. And at the end of the session, Patrick will talk about the Salesforce Maturometer and how to assess if your company is ready for true multi-channel. This being said, Patrick, the floor is yours.
Thank you, Annelien. So good afternoon, everyone. This is Patrick Vidal. I wanted to start actually with the view of Alex Azar, who is the former president of Lilly in the USA. Who basically, his point of view was really interesting in the sense that, he believed that the sales reps obviously are not dead and have a real role to play presenting to their customers. And I've seen part of it actually as some interactions that were created to reach physicians that were never called on by a rep. Which was their strategy, so the physicians not met by reps face-to-face. And they were basically able to convert interactions with 18% of those doctors that were never visited by a rep. In order to build, as he says, a long-term relationship and add value over time. Having said this, the multi-channel rep is not only dedicated to doctors who cannot be visited. Obviously, targets are also HCPs who are seen face-to-face, but do expect information at a different time of the day than the face-to-face visits. And as you can see, actually, from this study, most of the physicians, more than or nearly 2/3 of them, if not more, actually would expect to receive information about new medical development, treatments, outside of the office hours. So basically when they are not visited by the reps face-to-face anymore. And clearly, we shouldn't neglect the role of the rep in multi-channel for the doctors that they visit. And also clearly, they may have a role to play for the doctors who are not yet visited face-to-face. And there are different models, and we can't go into too many details or too much detail today. But there are different scenarios that can be implemented depending on your business objectives. So that sounds pretty obvious, but a multi-channel rep and multi-channel allows you to reach the right target at the right time with the right channel and the right content. And clearly there is a lot of work to do in this area, obviously defining the right channels, but also the right content. And doctors who are visited face-to-face should not receive, obviously, the same content that, from doctors who are never visited or visited not enough. And that content needs to be very specific per type of customer. And the reps would have a role to play there, mixing the face-to-face contacts. And it could be only once a year or twice a year for certain doctors, but relayed by the multi-channel interactions coordinated by the reps. And this is what we are trying to achieve actually with several of our clients. But it doesn't all fall to the rep in the sense that the content needs to be adapted and add value both to the doctors, to the HCPs, but also to the reps themselves. We need to be convinced that your company is going to provide added value through the different channels and that they have a role to play in it. Very often and most of the time, 80, 90, if not 100% of the contents are promotional, basically talking about the product. When HCPs also expect to receive medical, environment services and patients information. And this is also the balance in this content that needs to be addressed and to be reached. So the role of the marketing and the head office is actually extremely important in making the multi-channel rep a success. And then after, obviously, being able to track the impact of your customers' interactions, which also means that you need to define the right performance indicators and the right key performance indicators that will need to be tracked, and for which your sales force will need to be informed. And then, we enter into discussions with our clients in terms of rewards and bonus calculations, which in 95% or more of the cases today do not include interactions through multi-channel, like the number of emails that have been sent by a rep, or the number of opt-ins, email addresses that have been collected, or the motivation for a doctor to connect to one website and download the right information or view the video of the KOL that is there and then relayed by the rep face-to-face. So all this really needs to be implemented and properly planned so that multi-channel reps can be a success in your company. So moving forward, what we are trying to achieve, and I guess you are trying to achieve, is bringing it all together. So with the right channels, the channels which are feasible to be implemented for your company in your country, integrating them and planning, defining the right editorial plan, communication plan going forward, making sure that that plan is mastered by the reps and that they are able to optimize the impact of it between the face-to-face and the multi-channel activity, together with mixing the right content within the right context, and the context being obviously not only your business objectives, but the expectations of each of your segments. So defining also the right segments and being able to track on the impact per segment of your customers is key as well in this implementation. Obviously, for the doctors you visit, for the targets you decided to visit and who accepted to be visited by you. I mean, the reps should really know the best their customers and be able to select the right channel mix and the right content mix, depending on the content of discussions they would have face-to-face, the expectations of each of their customer, and be able to orchestrate between the channels and the content in order to deliver the added value which is expected by your doctors, and therefore creating the right impact. A first poll actually that we have for you is how likely is your company to equip your reps for the role of multi-channel orchestrator? So some of you may be already there, some of you are working on it to be implemented this year, or you are planning to implement it in the coming year and you're thinking about it. Basically you tried and didn't manage to, or either in the fifth option, you don't think it's an option for you. So I will open the poll. Just hold on a minute, please. Okay. So the poll should be opened. Can you please vote? We'll just wait 30 seconds before we close the poll. Okay, so the results, 66%, the two-thirds of you are actually working on it for this year, which I presume is one of the reasons you joined the webinar this afternoon. But one-third of you replied that you thought about it but couldn't get it off the ground. When we compare actually to 2014, which was the year that we did the first webinar, 9% were already there, which is not the case today, but a small half of it, 42%, were working on this. So clearly, I mean, you can see that the trend is that more and more pharmaceutical companies do consider the multi-channel rep and the change management as a key issue to allow their multi-channel strategy to get off the ground. But clearly, this is a pretty long process. It does take time, and you can't expect actually your sales force to get on board in a very short period of time. I mean, it will take several years, I guess, as a program to allow your sales force to be fully aware and familiar on how to orchestrate these different channels, and that will necessitate a lot of coaching as well from the regional managers, and also support from not only the sales and marketing management, but from the top management of your company as well. So we do see actually in the last mature method that we do in Across that reps are equipped with digital tools beyond e-detail, which is always something that is striking me because clearly, I mean, iPads are equipping most of the reps now in the pharmaceutical industry, but we don't get to see that many channels that the rep are orchestrating today. although, 45% somewhat agree. It's not really clear on which channels actually have been implemented by the pharmaceutical company to date and which are orchestrated by the reps. So second poll, asking you actually which of these multi-channel rep channels tactics have you already integrated? So if we open the poll again, yes, thank you for responding. Is the poll open, Anneline?
Yes, Patrick, the poll is open, but I hear that some people have issues to see the vote button at the bottom. So don't worry, we'll continue with the rest of the presentation very soon.
Okay. Okay, so let's continue. Okay, so sorry about this. So the channels that we see are mostly implemented and orchestrated by the reps are email, iPad detailing, which is actually the most common channel that is being used, remote detailing, and also self-service portals that would be promoted by your sales force. Email marketing, actually, we've seen in many campaigns we executed, is actually one of the most effective channel if properly driven by the reps. And there are many ways, actually, or different ways that email can be implemented for the reps to action with a selection of different contents which are relevant to the face-to-face calls that they do and are part of an editorial plan and campaign. The vast majority, actually, up to 60% or more, will be open to accept emails sent by their reps, and actually the ones that accept, some of them would be even ready to increase a little bit more. What we saw from campaigns in France is that the opening rate could be up to 70% compared to a third-party email product related, which would be 5-10%. And in newsletters sent by your company up to 20 or 25%. So basically, you can multiply at least by 2, if not by three, the opening rate that you get when your reps are sending the emails directly to the doctors that they visit. But obviously, they should also prepare the ground and prepare the doctor, inform the doctor on the fact that they would receive an email bringing additional value and communication on top of the face-to-face that they had. Remote detailing, that's actually a pretty aged study that was done actually by Kadrich some years ago, where also doctors who accept remote calls, so remote calls would be calls made by phone and internet to share a presentation through internet and present to the doctor. That actually those HCPs would be received to receive a high number of remote calls during the year, and actually some of them or many of them stating that they could even replace face-to-face calls. So there will be a mix between face-to-face calls and remote calls on different topics. Obviously, that shouldn't be on the same topic that is covered or presented with the iPad face-to-face. And another study that was also done actually at the time for Kadrich, analysis from IMS that was demonstrating that higher gain in market share was achieved with the combination of the face-to-face and remote calls, which is normal in the sense that the more you add channels and pertinence to the content you deliver to the doctors, the more likely they are to be satisfied and impacted by it. Since 2015, so only 2 years ago, actually, tablet detailing, actually from 2012. So in 3 years' time, iPad detailing took over from the website as the most popular channel. As nearly now all the sales force are equipped with iPads, which had some issues, as the iPad obviously does not replace the rep, and in many instances, the rep is presenting the iPad rather than presenting the content or being fully trained, and doesn't feel at ease actually when presenting with an iPad. And we'll see some more comments from HCPs in the second section on the customer experience and feedback. So what do physicians want and expect from pharma? These are extracts actually from virtual focus groups, so where doctors were able to express themselves on a virtual platform, being interviewed by a moderator, and we got some insights actually from different countries, which is interesting because from different doctors in the same countries, you would see that the expectations from the doctors vary in terms of content and services that they should receive from pharma. And also a lot of interesting comments on the way that reps are using the iPads and the added value that was supposed to be delivered by the iPad, but which is not there, basically. And the iPad is taking the place of the dialogue and the interaction with the rep when it's supposed actually to add on this interaction. And in many instances, it failed to deliver this additional interaction and impact that the pharmaceutical industry was looking for. So I just flipped from the different examples from the different countries, but there is a clear consistency in the very low adoption from HCPs in regards to iPads. And this is even confirmed from Navigator studies that we have run in many countries for many different specialties, where we clearly identified that the iPad is not adding impact compared to a face-to-face call without the iPad. It can do. A nice presentation adding information or just supporting a key point presented by the rep face-to-face would add impact. But in many cases, it doesn't. And just an example from Spain, actually, and this is what also is demonstrated from the different feedback, is that doctors' expectations would vary, and not all doctors are the same. And clearly, multi-channel also helps you to provide the information through different channels to ensure that at least one HCP, the HCP is going to access the channel and get the information at the end. So this mix of channels also allows you to ensure that one channel gets through. So I leave the floor to Anneline now to present on insight that we get from the Navigator Lens.
Yeah, thank you, Patrick. Another way to get indeed insight on what physicians want is to have a look at the results of the cross-channel Navigator Lens. Some of you might already have heard about the Navigator landscape that gives you an idea of the reach and the impact of different channels. Now, the Navigator Lens is a new offering from across health, and it supplements this research. It gives you a more in-depth information on a number of channels. It informs you about what content and what services physicians expect from a particular channel, which companies are excelling in the use of a channel, what emerging trends are, etc. And I'll share with you some of the findings from the US Neurology Navigator Lens that was executed end of last year. So the first channel that was researched is the tablet detailing, and what came out of this, that in general physicians think there are way too many screens, and as a result it takes way too long. So what type of content would physicians want to see when they look at the iPad details? They still want to see clinical trial results, although to a lesser extent than what they are being offered today. But they also want to see more cost and outcome information, for example, as well as comparative product information. And that's much more than what is the case today. Finally, when you think about the videos, for example, the patient cases that are being offered today, and as a fourth offering, actually physicians would prefer to have less of that type of content. Of course, this depends very much on the country. Here we're talking about neurologists in the US. Another type of information, and it's of course information needs will be different depending on the stage in the product life cycle stage. A product that has been on the market for more than 10 years does not necessarily require face-to-face visits. As you can see here, a mix of emails, phone calls from the company, and info on the pharma website could be sufficient as well. And sometimes we hear skepticism from colleagues in the pharma around the subjectiveness of the pharma websites. But as you can see here, the pharma websites are preferred over the independent websites to get product information. With the Navigator Lens, we also have a deep dive on what physicians expect to see on a pharma website. It may differ largely by therapeutic domain, of course, and by country. But on the right-hand side, you see that that we see in general that there's a confirmation that physicians really find pharma websites useful, or at least nice to have, more than 80% in total. So first step is indeed to gather insights on what physicians are interested in, depending on your country, depending on your therapeutic domain. Now, next step is to try and meet those expectations in the spirit of true customer centricity. Some companies have moved from a siloed approach in terms of bringing different channels towards a more integrated approach by the introduction of campaign flows. So depending on what interaction takes place first, the next action is being triggered either automatically or manually. This may sound and look very trivial if you look at this slide. Nothing really strange pops up. But we see that a lot of companies are struggling to make this happen in real life. Some companies start off with too complex campaign flows, and so they are not manageable in reality. And others are struggling with the infrastructure behind it. And for example, they are not able to bring the right information to the reps in case they are part of the campaign flows. The typical issue is that information is either not captured or is captured but sits on different systems that are not integrated. So the data that might be useful does not end up where it needs to be. So there's still some room for improvement, but to start with campaign flows is definitely a good first basic step to take. Just make sure that they are not too complex and that your infrastructure is following as well. Another initiative that pharma companies are taking is to move towards the personalized landing pages on the website. All the information that is relevant for the individual physician and for example, that the reps have used during their face-to-face interaction is visible at the first glance when a physician goes to the landing page of the pharma website. And ideally, this is linked with the tablet detailing of the reps, so that the rep at the end of the visit can choose exactly which topics, which content items should appear on the website, on the landing page of this particular physician. And in this example, we even go one step further, and the content items are bucketed. That is done by marketing, according to the stage in the adoption ladder. So it's either interest, initiation, increasing prescription, or becoming an influencer. So depending on the stage of where the physician sits in, the rep has the opportunity to choose the right content item to appear on the website. And the next time that the physician goes on the website, he'll see the personalized approach. This were some examples to show that the focus is on improving customer experience and that it will eventually lead to the shift from share of voice, which is a quantitative concept, to quality of voice, which is a matter of indeed having the right message brought to the right channel. Another challenge is equipping the multi-channel rep with the integration between sales and marketing. There's some room for improvement there as well. We see in those results from the Maturometer from last year that there's only 14% of companies that have implemented robust customer analytics frameworks. And so the large majority is doing some analysis, but it is clear that there's still a nut to be cracked on this front, we would say. And thinking about sales and marketing integration, what is key here is to find the balance of how much information that needs to stream from the marketing to the reps. What information do the reps really need? On the one extreme, you have the fact that the reps only have a view on their own face-to-face interactions with their physicians, which is still the case in a lot of pharma companies, not to say the majority of pharma companies. And on the other extreme, you have, you can imagine that the rep has an overly detailed view on all the interactions that took place. You can see this here in the black part, where the rep really sees every interaction, and it's difficult to see the trees in the woods, let's say. So both extremes will not satisfy your sales reps, and will definitely not lead to better customer centricity. So it's a matter of finding the right balance. And how do you find the right balance? There's actually three characteristics on customer interactions data that could help you. First of all, and they're not rocket science, they're basic things, but you need to think through them to get a good understanding of what is needed. The first one is the information needs to be relevant. For example, the fact that the physician has received a reminder email about an upcoming webinar for which he has subscribed, that will not really be relevant for your physician, for your rep. The link with the sales rep's objectives should be clear, and in this particular example, that is definitely not the case. So relevant information is, of course, number one. Actionable information, the more action-oriented, the better, I would say. If you can combine the data and crystallize it, the information to formulate a next best action, it becomes really actionable for your reps. So an example could be that the physician has first clicked on a particular email, and he's also visited one of your webinars on a particular topic. That shows a clear interest in that topic. So a next best action for your sales reps could be, this is an important piece of information. Please send an email to this physician, as he has done this and this before. And finally, and for the information also needs to be timely. Nothing worse than information that comes way too early, or even worse, way too late. It often happens when information is stored in different systems and needs to be manually transferred from one system to another. And it happens once every so often, I would say, in other pharma companies. Some information still arrives at the rep level way too late. So these three criteria to decide on how much information and what type of information you should give to the reps. And I want to make it a little bit practical. In the next slides, I'll give you a kind of a best practice example from a pharma player that initially they only had a marketing dashboard, as you can see here. So only marketing had a good view on it, and they wanted to move to use the information that was behind it to a real planning tool for the reps. And they started off with the idea of lead scoring. Lead scoring is a concept that is already widely used in other industries, telecom, for example. And it's a methodology to rate your prospects, or in this case, to rate your physicians against a scale that gives you an idea how important the lead or how high the potential of this customer is for your company. And the pharma company about which I'm talking has used this to help the sales rep decide if the physician is worth a visit, a face-to-face visit. It's a basic version of lead scoring that they have implemented, but it really fits the needs that they had. As the scoring components of the lead scoring, so you have different types of components, implicit and explicit scoring components. But the key one was all the omni-channel interactions. And you see here on this slide on the left-hand side that each activity on and offline gets a score. For example, reading an email, 0.5, customer reading a page on the website, 1 point, up to watching a webinar, which gives you 3 points. A simple scoring system, but easy to interpret also by the reps. Not only the channel interactions were given a score, also the account potential did play a role, and also the sales rep opinion on the importance of the physician. So this finally leads to a scoring that the reps can see and on which he can decide whether he is going to go for a face-to-face visit. And now key in this whole story is that there is an iPad application built for the reps with the lead scoring tool in there. And they see, the rep sees a high-level score for each of their physicians, as well as the category of the interactions. So the interactions were always categorized. Is he more patient-centric? Is this interaction more based on patient centricity? Is it more based on real-world evidence, etc.? So the rep could see not only a score, but also the category of the physician showing his interest. The lead score is one thing. The tool also allows the rep to dig deeper and have a view on more details of all the different interactions. But that is only in a second step. So first of all, the information that the reps receive is very simple. They have a list of their physicians and they see the lead scores. And only at the next step, they can dive deeper in it. It's a true dashboarding tool for the reps themselves based on the marketing dashboards that was initially there. I don't want to go into the details and the technicalities of it, but I can tell you that this tool is built in ClickView. It's a dashboarding tool that has the advantage that it can get information from different sources and from different databases and put this easily all together. So that's a real nice example of a good integration between the information that comes from sales and marketing, and a good way to think through for your own company as well. This being said, I will hand back to Patrick for the final part of this webinar. In case you still have questions, don't hesitate to use the buttons at the bottom to ask your questions. In case you don't see the buttons, because we hear there are some people having an issue with that, we'll send an email at the end of the presentation as well. And if you still have questions, feel free to reply to that email so we can still respond to them, but that will be after the webinar. Patrick, I hand back to you.
Thank you, Anneline. So in 5 minutes, we will cover the last part, which is regarding the Salesforce Maturometer. And just a point, I mean, there are several topics that we didn't cover in this webinar, being the third that we provide on the Multichannel Rep. If you'd like to know more, you can refer to the last 2 webinars, which are still recorded and available on the AcroSales website in the past events. So you can go on our website and you'll be able to view the previous 2 webinars that we provided. So to conclude on the Salesforce Maturometer, I mean, that's just a simple trick, but to help your organization get ready for multi-channel and omni-channel. And basically, one of the key questions is to know and define where you stand now, and obviously where you want to go, and what should be the steps that you take to get there. Clearly, transforming the field force into multi-channel reps is one key priority for many pharmaceutical companies, and actually moved up as the second key issue to address for the pharmaceutical industry. And indeed, I personally do like very much this slide. The successful digital transformation, as you can see, depends on 4 criteria: the need for change. If you don't believe that there is a specific issue or business objective that you need to reach and that you need to change, it would be very difficult for you to make the change accepted by your organization. The clear vision and goals would refer to a very clear roadmap defined and a clear view on your multi-channel strategy, both as a company and also obviously for each of your business unit, franchises and products. And then the capability to change is key. Clearly the best multi-channel strategy cannot be implemented in the proper way if it's not well executed by your sales force. And then the definition of the concrete first step and the combination of the 4 will lead to a successful change. So in order to assess this capability to change, we do try at the start to get the foundation right. And the foundations would be the customer expectations, together with the right targeting and segmentation, prioritizing the channels, the ones that are feasible for your company to implement in a technically safe manner, and easy to use for your sales force, and all these based on the right tools, whatever they are. The EMI or the Viva of the world, and a team collection process, which is properly understood by the reps, not only on the technical point of view, but also on why should they collect the email of their doctors, as very often actually they have them already, but for their own use and making appointments and communicating with their doctors. But why should they collect it for their company, being afraid that the company would send too many emails or not related or not interesting to their doctors? So in order to assess all this, we do try to set the ground in the right way and measure the capability or the capacity of your sales force to accept the change. And we do that with an internal maturometer, exactly in the same manner that we have developed one to assess the multi-channel maturity of your company at the head office. We do also, we have also created a version that can be used for your sales force, and basically to assess their knowledge, their beliefs, and there are many in terms of digital tactics and also what they think of their customer behavior and also expectations. What is their perceived value of the digital, and what is their willingness to get on board. And from the outcome of that maturometer, then you can define the priorities to tackle in terms of change management for your sales force. Obviously, you can benchmark this as well with the same type of maturometer for your head office and assess where there are gaps, and there are bound to be. And then this kind of analysis should be done very regularly, monitored and controlled as well by the sales management and obviously the district manager, who would be the first to identify any issues, any laggards or innovators or leaders, and be able to guide them and coach them over time. And then again, it's going to take time, so there should be some achievable objectives in the medium term, and proper assessment and also proper recognition of those who achieve very well. So the different steps, that's a long journey. It starts with embarking and getting on board the management at all levels. We do advise to select and train ambassadors. What we call ambassadors would be key members from your sales force, who would be willing to embark in the journey. And I'm not saying that they should necessarily be the most digital ones or the younger ones. It's not related. Those who are willing to join the change are those with the right profile. Then coaching and recognizing the ambassadors. I mean, basically making the change visible within your company and demonstrating how they were able to achieve higher impact, higher frequency, and interviews, videos. Before then, you use these ambassadors to deploy and make the change. And actually, those ambassadors could actually become the trainers as well of the rest of the sales force, because they would be able to share on their daily life and the daily reality of their job and indicate very concretely how they were able to address any objections from a doctor, for example, to provide the email, on how they were able to do remote detailing with some of them, how they were able to convince them to go to the website and download the information that they mentioned during their face-to-face, and so on. So it's not a very simple approach, but we do believe that this step-by-step approach is very pragmatic, down to earth, and that those are the necessary steps basically to make the change happen within your sales force. So thank you very much for your time this afternoon. We appreciate it. It's a bit frustrating that we can't speak between each other, but feel free now to ask any question that you wish. There is also, I mean, you have the opportunity to provide as well your feedback and score this webinar. So we would appreciate very much if you could do that. I will leave you the time to ask some questions and already respond to two questions that were asked during the presentation, during the webinar. The first one was, do the figures refer to a specific country? And that was related to the expectations from HCPs to receive medical information, and where we saw that it was mostly outside the office hours. That was a study actually covering European and countries and the US. So not specific to one country only. The second question, which is more to you, Anneline, was referring to the campaign flow that you showed, the campaign flow to use as a basic starting point, and was this an out-of-the-box software?
The flow that I've shown on this slide was definitely not an out-of-the-box software, and it was more a manual approach, I would say, to campaign flow. But there are indeed a lot of marketing automation tools available already today that can help you to build similar kind of flows and to automate as much as possible. Now, I also understood that there was a question on the software, whether the software that I showed in the case example with the lead generation, the lead automation tool, that was not an out-of-the-box software either. It was actually something that Across Health has developed for this particular client with the help of some external vendors. But the key thing there was that the dashboard tool was able to gather information from different databases.
Another question about the webinar being registered, recorded. Yes, absolutely. And you are all going to receive a mail with the link to view the webinar again, or to send it to whoever you wish. And it's going also to be made available as the two others, actually, as I mentioned earlier. It's going to be available on the Across Health website in the past events, and you'll be able to watch this webinar and the other ones if you feel like it. What do you consider, another question, what do you consider as key competencies for a multi-channel sales rep versus the traditional sales rep? That's a very good and question that we get very often. From my point of view, I would say the open mind and the willingness to change. Definitely not related to the age. Definitely not related to the experience. I would say it's more a state of mind, and being able to recognize the expectations from their customers and being able to or willing to accept that their customers may be willing to communicate in a different manner, which is the case as we often demonstrate with the Navigator study or the virtual focus group outcome that I presented earlier. Now, this willingness to change is also linked to the fact that they are explained properly on what is the multi-channel strategy of your company, what are the different steps that the company is willing to take, and what will be the added value delivered to their customers. I think they need also to be very much reassured on the fact that they are there to stay. The reps are not, are not dying, like I presented on the first slide, and that they have a key role to play in regards to the customers they meet. But we can demonstrate to them that their customers have different expectations as well. That they can't provide everything by a face-to-face, and that at the end of the day, it will enhance as well their relations with their customers. It will add value, basically, to the relations that they have with their customers, and they will remain the orchestrator of that relation, at least for the customers that they visit face-to-face. Now, multi-channel is not only for face-to-face customers. Multi-channel will also help you to address the expectations and the needs from the customers that you don't visit today for different reasons. It could be lack of resources. It could be also linked to the fact that they don't want to see you, or they don't want to see the medical reps, and we shouldn't forget them. And those doctors, they do have expectations, and they do open emails from pharmaceutical companies, and they do accept remote calls. Now, the idea would be if those doctors that you don't visit today 6, 8, 10 times per year, they could have at least one contact or 2 contacts per year in a human way. I mean, with a rep, they would be very satisfied. Some more question. Any country where this was more successful versus others? Well, there are reasons why it will be more difficult to implement it in different countries, which are linked especially to, how could we say, trade unions or councils. Now, it can work in a very good manner, again, and all the reps, whether they are from Italy, Germany, France, the UK, are willing to move into this multi-channel orchestration as long as they see the benefit of it and as long as they have the tools and the content, tools that would work and the content that will make sense to their customers. So then again, it's really a question of step-by-step approach. It will not be possible to track on the interactions and the granularity with each of the doctor, especially in Germany, but also in France. That could be difficult. But I don't think it matters that much. At the end of the day, it's really to provide the added value to your customers. If you can't track the number of times that a rep has sent an email to the doctor, so be it, Do we have more data and information by country, like the US example, for the UK, for instance? I think you refer to the Navigator Lens data. Actually, that was launched in the US. We are actually reshaping the structure of the study, and we are going to make it available for all countries and all specialties by September this year. So there will be more data for the Navigator Lens for the UK soon. I'm just looking at the question, but I think we replied to all of them. So, unless there is a new one, I thank you very much. We thank you very much for attending this webinar. Don't hesitate, as Annelien said. Yeah, please go. Yeah.
Yeah, sorry. Once more, for those of you who have issues to submit a question, feel free to reply to the email that you will receive later today. Apologies again for this small issue.
And thank you in advance for responding to the satisfaction survey, if you can, before leaving the webinar. And you will receive a link to access the webinar in a recorded format. Sorry, there is a last question. Do you include medical and access? I mean, definitely, yes. Yes, we do. I mean, now it's a different way to tackle. I mean, especially in the medical and but the MSL programs, the MSLs, and I mean, there are. It's a different manner to implement that change management. It may be more flexible because basically different types of contents can be provided without being all formatted in advance. But yes, we do. Okay, so thank you very much. Thanks again for scoring that webinar, for your feedback, and don't hesitate if you have any questions after receiving the links by through emails. Thank you very much. We just leave a couple of minutes for you to be able to score the webinar. Thanks a lot and have a nice evening.